This is a summary of how various medical conditions may affect the utility of a low carbohydrate diet and its safety.
Patients with type 1 diabetes have known immune destruction of the pancreatic cells that produce insulin
and therefore require external insulin to be able to transfer energy from food to their cells. The old paradigm was to tell patients to eat carbohydrates and for every 10 grams add a unit of insulin. But patients with type 1 diabetes also develop insulin resistance and require exceptionally large amounts to combat a high-carb diet. Dr. Richard Bernstein's an 86-year-old doctor with type 1 diabetes who wrote The Diabetes Solution. And in this he proposed a paradigm change to increase insulin sensitivity, lower requirements, and improve blood sugar control. Now,
in type 1 diabetes, we know it's a disorder requiring absolute replacement of insulin.
But it's critical that type 1 patients understand that exercise is a form of control over blood glucose outside the loop of carbs and insulin. And type 1 diabetic patients should be medically monitored. A continuous glucose monitor is extremely useful in making the switch to a low carbohydrate lifestyle for these patients. The Type 1 Facebook group can be a helpful peer support group, and members frequently score their HbA1c levels under 7. Type 2 diabetics, including those on insulin, in a similar situation might also require this degree of medical monitoring. Now, many patients identify as having sharp crashes of energy, concentration, and mood following ingestion of sugary foods. An oral glucose tolerance test or continuous glucose monitor
can show them that they have a rapid drop in blood glucose that follows a rapid rise after a sugar load.
Now, these patients have erratic insulin secretion and action, which pushes glucose into cells and doesn't leave enough in the bloodstream for the brain to function. This leads to the sugar crash, and these symptoms occur because hormones including adrenaline, noradrenaline, and glucagon are released to make more glucose from the liver. And this gives patients an unfortunate feeling of
low mood, anxiety, immense hunger, and irritability during these periods.
It really is driven by hormonal dysregulation. These patients are often given sensible advice to avoid sugary foods and drinks, add protein to smooth out their blood sugar response, and to eat small meals frequently. However, a ketogenic diet allows them to overcome the condition by stabilizing blood sugar and providing a second source of energy for the brain in the form of ketones. The decline in estrogen levels that characterizes menopause affects cardiovascular health, bone health, and changes the distribution of fat deposition as well as the set point of total body fat in most women. A low-carb approach is effective in menopause, and the same advice applies to women transitioning to menopause to lower insulin levels. Menopause might make it more difficult with increased stress, poor sleep, and symptoms, but adequate protein intake and regular strength training can also assist markedly and are essential in maximizing lean mass and insulin sensitivity while slowing the loss of bone mass. Now, while they might affect the basal metabolic rate and cholesterol synthesis, there's no contraindication to a low carbohydrate lifestyle in any thyroid disorder. Thyroid function might change on any diet that restricts calories, but underlying disorders must be addressed. Now, the major consideration after bariatric surgery is a condition called dumping syndrome, where patients can develop malabsorption and diarrhea. Given the limited food portion tolerance from the surgical change they have to their gastrointestinal tract, nutrient density is very important, and supplementation. Now, what about supplements? Do I need them? This is a really common question from patients. And most people won't need any form of nutritional supplement to support their progress whilst living a low insulin lifestyle, because a well-formulated diet has been shown to be nutritionally replete. There are cases where supplementation can be helpful, and because of the low cost and low risk, the benefits probably outweigh the risks for most patients. Now, while the general philosophy should be that lifestyle measures give us the biggest effect size for most health goals, medications can be prescribed on an individual basis with the goal of improving insulin sensitivity and glucose disposal. Insulin sensitizers include metformin and chromium picolinate, but in most cases, it's more about what you take out than what you put in. Now, the following list is a list of supplements that may have benefits for certain patients. Chromium can improve insulin sensitivity and glucose disposal. Vitamin K2 may reduce vascular and soft tissue calcification and maximize bone mass. Omega-3 fatty acids can reduce triglycerides and inflammation. Magnesium might assist with muscle cramps and sleep quality. Iron can be required for dopamine and melatonin, which are important neurotransmitters for sleep, energy, and mood. CoQ10 can improve mitochondrial function. L-arginine might assist with endothelial health by increasing nitric oxide. L-carnitine is seen to assist with the use of fat for energy or fatty acid oxidation. Phosphatidylcholine and lecithin can assist with fatty liver disease. And nicotinamide or NAM may assist with cell repair, and in particular non-melanoma skin cancers have been shown to be reduced. Now, metformin is a medication that is considered first line in type 2 diabetes. It's in a class of medication called biguanides. It's an insulin sensitizer and works by improving the sensitivity of insulin receptors
in the liver and muscle.
It also reduces glucose output from the liver, which can drive persistently high insulin levels, particularly in patients who have fatty liver disease. Now, lastly, it's thought to assist in weight loss via mitochondrial uncoupling. Myo-inositol does a similar thing. It's most commonly used in patients with polycystic ovarian syndrome. GLP-1 agonists are injectable medications that increase the activity of glucagon-like peptide 1. The effect of increasing it is that glucagon levels are lowered. This means the liver can't make as much glucose, and while it raises insulin levels in the short term, there's evidence that these agents are effective in lowering insulin and increasing fat oxidation in the long term. Now, these injections are not covered by the PBS, and they're quite expensive at about $1,000 per month, but they can be useful adjuncts for patients with very recalcitrant metabolic disease and obesity. Sometimes the biggest enemy is not the carbohydrates or the insulin or any of the scientific principles we understand and rationalize in medicine. Sometimes the biggest barrier to metabolic health is entrenched habits and sugar addiction or binge eating, and these can drive destructive eating behaviours. We know that the reward pathways are the same, that your brain pumps out a little bit of dopamine every time you see, smell, or taste something sweet. And on functional MRI, the same areas light up as for heroin or nicotine addiction. Food and sugar addiction is just as real and potentially destructive. Now, naltrexone can be effective in reducing sugar cravings and managing binge eating disorder via its effect on the brain's reward pathways. In patients where this is the case, psychological strategies and sometimes the short-term use of naltrexone, which is a medication used to reduce cravings in alcohol and opiate-addicted patients,
can be very helpful to establish and deepen new neural pathways and habits. It can get you started.
But a supportive environment and motivation for change is the number one most important factor here. Allopurinol lowers uric acid, which may improve endothelial health because uric acid blocks nitric oxide production. So this helps dilate vessels in patients with very high levels, and it might assist with high blood pressure.
SGLT2 inhibitors block a reuptake pathway for glucose in the kidneys, so patients have lower glucose and insulin levels.
They're very effective in reducing both microvascular and macrovascular complications of diabetes affecting the eyes, kidneys, and nerves, as well as the heart. It's very important that patients using these medications are medically monitored and possibly advised to cease them if they intend to use a low carbohydrate or ketogenic diet, as these medications have been found to precipitate diabetic ketoacidosis, which is potentially life-threatening. Without such medications, a low carbohydrate or ketogenic diet does not cause these complications if patients don't have type 1 diabetes. Other tips. Avoid caffeine. after midday, because caffeine has a half-life or time for it to be eliminated, half of it to be eliminated, of about 6 hours, so it stays in your system. And the contraceptive pill doubles this, which can lead to really poor quality sleep. Alcohol can also hamper sleep initiation and quality of the later phases of sleep, which are known to be more refreshing. The best first-line medication prescribed and monitored by a doctor is melatonin, particularly for jet lag, but also for sleep phase disorders. Regular exercise and mindfulness strategies can help keep you in the moment and separate you from any thoughts and worries. Smiling Mind and Headspace are both excellent apps that can help guide you in this regard. The gallbladder has the job of putting bile, which is a kind of soap that our body makes to break down fat, into the first part of the small intestine. This dissolves and emulsifies fat to allow us to digest it and absorb it. A gallstone is a mass of cholesterol, pigment and other minerals, mostly calcium, that forms in the gallbladder. Up to 80% of people with gallstones never have symptoms. And symptoms occur when the stone can get trapped in the bile duct that connects the gallbladder to the small intestine. And this causes pain in the upper abdomen and problems like inflammation of the gallbladder and even infection may occur. Sometimes the pain settles as the stone falls out of the bile duct and it can dissolve without the need for surgery, but medical monitoring is required. And some people live with recurrent attacks of gallstones and cholecystitis for years and do not have surgery to take their gallbladder out. The reason is these stones are thought to develop is incomplete emptying of the gallbladder,
often with a low-fat diet.
In fact, studies have shown that one of the most effective treatments to resolve gallstones is a higher fat diet. And there is also an expensive medication called ursodeoxycholic acid that can assist. A high-fat meal results in a stronger contraction of the gallbladder and leads to more complete emptying. And although this helps resolve gallstones, when you already have gallstones, changing to a ketogenic diet can increase the risk of pre-existing gallstones getting stuck in the outlet of the gallbladder. And this is why you'll be asked and examined for signs of gallstones before starting a low carbohydrate diet. If this does occur, you'll need medical attention and advice, but rest assured, not everyone needs their gallbladder taken out. And the low carbohydrate diet, but possibly in combination with medication, is the best chance of resolving the problem long-term without surgery.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.